So I will open it up to questions and answer them the best that I can.
Questions for Amber. Amber, actually, I have a question that I'm going to ask because it gets asked to us a lot. And that is, if somebody is listening and they are a woman that has a bleeding disorder or believes they may have a bleeding disorder, and they feel that they have had trouble finding a provider that is going to listen to them, what would be your advice to them specifically about how to go about finding a provider that is going to listen and adjust their needs?
So I wish I could say that it was easy as referring people to their CDC directories and going to the HTC, and I would be naive to believe that that was an option that works for everyone in every situation. What I have found works better is the network that runs behind the scenes, our grapevine of friends that have had situations where they have connections to people who have said, hey, you should try this individual because this is my situation and it's similar to this situation, and go and see this person. And sometimes that's someone who's local, and sometimes it's the patient, sometimes it's the person at an HTC. And I would love to say it's always the HTC, but like I said, I will be naive and misspoken if I said that everyone will get the care 100% that they are searching for, until we get to the point where we can advance HTCs a little more. And I want to do that, and we work hard to educate everyday individuals and providers. But I do realize that sometimes, whether it's the person or the differences that come, that's not always the answer. So I would just still advocate for groups of women to talk with each other and find out their resources and what's available. And sometimes that means that, I've had patients that, yes, have come to me to be diagnosed, and I've put together a plan of care and sent that back to their HTC. And sometimes that opens doors that were closed before, and sometimes it still keeps that door closed. It's just really depends on the circumstance and the context. But I always say it's worth for people to try and see where can they get what it is that they need. And sometimes that's at our HTC, and I love when it's at the HTC because we can follow you guys, we can do registry, we can advance research. And sometimes there's a lot of different HTCs in California. Sometimes if you go to one that's not your regular one and it can talk to the other HTC, sometimes that works. So I would just encourage you to use the networks and resources that you have and reach out to the HTC and just say, hey, I know that when I came in 5 years ago, there wasn't that much for women with bleeding disorders. If I come in now, what is it that your HTC has done differently since then? Give them the benefit of the doubt that things have remained the same in the last 5 years. It's possible that they may have changed. And I'm going to give out hope and hold hope that each year that will be different. So each year, keep taking a look at that, keep taking a look at the options that you have, and kind of go from there. I wish there was better answers in terms of knowing where everyone can go, but it's going to be individual for each individual case.
Thanks, Amber. I think that's great advice. And for those that are on the line, if that's an issue for you or an issue for someone feel free to have them reach out to us at the council. We can try to help you get connected with Amber, and between the council and Amber, maybe we can help you figure out a good place to get connected if you're struggling, and kind of use that network of knowledge that we have. Your local chapters are also the foundations, the patient groups locally that you're connected with are also usually great resources to know how to connect you to the resources that are close to you in your area. So those are all options for you. Thank you, first of all, Amber, so much for your time and for that excellent presentation. Thank you all for joining us. This series is part of a series of educational webinars that the council presents. We will have the recording and the slides available in a few weeks on our website. And we will have more webinars coming up. we're looking at sort of adjusting to the new reality that we're all facing right now and seeing what information would be most timely to provide to all of you. So watch your inbox for more information about what the new topics will be coming out in the coming weeks, and we will send that information out. You can also find it at our website at www.hemophiliaca.org. And you can sign up there to be added to our email list if you're not already on that list. So thank you all again so much for your participation. Thank you again, Amber, and we hope that everyone stays well. And please, if there's anything we can do to assist you, don't hesitate to reach out to us at the council. So thanks for joining us today.